This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. Delighted you could be with us today. You know, Thomas, today children, adolescents face so many problems that you and I didn't face, and it creates depression.
Well, I actually experienced a conversation with this over just a recent few days ago. A group of people, not in Texas, they were still in school for another week or so, and they were saying that they are having a very difficult time even going back into the building. They are so depressed. So it's a very real issue.
Yeah, kids are facing that. They're facing bullying. They're facing an enormous pressures. Why don't we bring in Dr. Stevie Puckett-Perez, who's a pediatric psychologist at Children's Health and also on the faculty at UT Southwestern.
Dr. Puckett-Perez, welcome to the program.
I'm very happy to be here. Thank you for having me.
You know, as we look at many of our children today, we've been going through a pandemic for over 2 years. Obviously, they're exposed to the war in Ukraine, kind of the overall toxic political environment, and of course, school shootings. I actually read somewhere that 60% of children have depression and really receive no treatment. Is that accurate?
Unfortunately, it is accurate. And when it comes to depression isn't a permanent state. And so that 60% of children that you read about, that fluctuates a bit. Oftentimes, when people go through depression, it may resolve on its own. However, there are signs and symptoms when people need more treatment. And oftentimes, especially in this climate right now, where systems are overburdened and there are more children and even adults who are having these struggles, kids are going without treatment and they're kind of left to their own devices to move through those mood disorders and challenges that they're having.
You brought up an excellent point. Adults also, because of the pandemic and so many other things, are having depression themselves. But for a parent, how do you know if your child is experiencing, say, more than normal ups and downs? And when should you seek professional advice?
I would say, with everything, we just want to have big open eyes when it comes to our kids. And every child is different. And so what we're looking for is really changes, anything out of the norm. If you're seeing differences in your child, and these differences may come up in more obvious ways like mood changes, like you might notice more sadness, more irritability, more moody feelings and up and down emotions, more sensitivity. However, it might also show up in behavior. You might notice some big or small behavioral changes or habits. They may become more withdrawn. They may become more hyperactive. Really, there isn't one specific thing I'd say to look for other than monitoring mood, behavior, and habits and seeing if those are starting to shift. In some kids, we may even notice regressions. And by regressions, I mean the loss of skills that they previously had. They may regress to an earlier developmental level, such as bedwetting, nighttime wake-ups, not doing certain things that they previously were able to do, maybe wanting to sleep with parents, maybe thumb sucking. These types of behaviors can let us know that children are needing more security and safety and that they're experiencing some mood changes.
One of the things I was curious about, I was talking to a friend whose child did have depression, and they said that they started having physical symptoms like headaches and stomach aches, and there was no apparent medical reason. Is that also a symptom?
So, Steve, actually, this is one of my areas of expertise. Yeah, these somatic symptoms, we call them, or functional symptoms, are incredibly common. And in fact, they happen more in children than adults, but it may show up as any type of symptom in the body. You can have headaches. You can have events that look like epileptic seizures when in fact your body is entirely safe in not having a seizure. You can have stomach upset, digestion problems, nausea, vomiting, aches and pains. oftentimes, and this actually truly happens for all of us, and there are lots of great explanations about the neurobiology of why this happens. It's not made up. It's not faked. This is truly real symptoms that are occurring in the body because of distress. Whenever we experience anxiety or depression or any big mood shifts, sometimes even positive mood shifts or big habit shifts, that takes a toll on our bodies. And the chemicals and neurotransmitters in our bodies respond to that. And as they go up and down and they change in the body, they can lead to some very real physical symptoms. So absolutely, when we are seeing aches, pains, fatigues, more tummy aches, more headaches, or other physical symptoms, that's often a big sign, especially if you've seen your pediatrician or any specialist needed and they've ruled out anything physically concerning or any organic damage in the body. Then it lets us know this is what we call a functional symptom, and it's happening almost as a glitch in the body. We're getting these symptoms, even though your body is safe, stress is triggering that.
You know, you mentioned change in normal habits. Let's focus a little bit on eating. When you have a change in an eating habit, does that mean the child is eating less than they normally do, or are they eating much more than they normally do? Or could it be either?
Unfortunately, it's not clear. It could be either. And so when we are assessing for depression or big mood disorders, we are looking for, has a child's appetite changed? Has it gone up or down? Have their sleep patterns changed? And that could go up to where they're sleeping all day, or it could go down to where they're really struggling to sleep. Same thing with their activity level. They can be more active or kind of hyper, or they can be really withdrawn and have psychomotor retardation, meaning that everything is just slowed and they're not doing very much physically. And something else we look for is not enjoying the same things that they used to enjoy. And so if they are not getting pleasure out of the activities that they previously liked to do, that's a sign we look for as well.
You know, if you have a very open communication with your child, which is a good thing, but they begin to express self-harming behavior, what should you do?
Yeah, so first I'd like to say that suicidal ideation and self-harming behavior are two different things, and both can be incredibly scary for us parents. But from a psychology perspective, these are two different animals we are dealing with. Many, many children experiment with self-harm. It's not a good thing and it's very alarming, but it does not necessarily mean that they are suicidal or want to end their lives. So that's the first clarification I would want to assure parents of. But either self-harm or suicidal thoughts or feelings that are coming up, both are likely to need professional help because there's a process of supporting kids through navigating those big and difficult feelings. Oftentimes when children are self-harming, it is not to kill themselves, but as a method of controlling some underlying distress, grief, or emotions that they're having.
We are listening to such an important conversation during these times. Dr. Stevie Puckett-Perez from Children's Health and UT Southwestern Medical Center. And when we come back, what if your kids say, I don't want to go to school? Stay with us.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We're going right straight back into our interview with Dr. Stevie Puckett-Perez, pediatric psychologist at Children's Health, also on the faculty at UT Southwestern Medical Center.
You know, after tragedies occur, whether it be a car wreck, a school shooting, how do parents really talk to their kids?
Yeah, so I would say that it depends a lot on the age of the child. For younger children, we are the filters of information to them. So we get to decide what we share and how we share it. And the simpler and more concise, the better. In fact, for very young children, they may not need to know any of this at all. If they can be shielded from trauma, then in very young ages, it makes sense to do so. However, for older kids who are going to be around others and are very likely to hear this information from another source, we want to bring it up. We don't want to wait on them to come to us. For older kids, we're not the filters of their information. Instead, we are the organizers to help them make sense of the information they've already got from the environment. And so for older kids and teens, I would start that conversation by asking them, I know you've probably heard about this. Tell me what you've heard. Learn about what their friends are saying about it, what their teachers or other people they trust are saying about it. And, just gather all of that information first. Let them tell you the story of what they know, and then correct their misperceptions or any inaccurate information that they have heard. And then elicit whatever emotional responses they might have had to that, how it makes them feel, what their worries are. And then for older teenagers, oftentimes they need to reestablish some sense of control or something that can be done. They're going to ask parents questions, very hard questions we don't know the answers to fully, like, well, what do we do? Like, how do we stop this? And we all know that's a much bigger conversation and a much bigger systemic thing that, as an individual family, we can't tackle necessarily. And so identifying the ways that your teen, your young adult or older child can feel in control and things they can do to help make the world feel safer and make things a better place, things they can do to show kindness to others, to be a helper. Also, we focus on the tragedies and the terrible, terrible pieces of these stories. And instead, while those things are true, we also want to balance that with the heroes of the story, point out the heroes, point out the helpers, point out the people who are actively working to do good things to make people safe.
As you look at some of the things that children today really have to contend with, one is bullying. Does bullying figure into this equation in your professional opinion?
Yeah, bullying is incredibly detrimental, and it is especially when it recurs. So when there is an unresolved kind of bullying incident at school where children are having to repeatedly go into a situation where they feel unsafe and insecure, whether that's bullying or honestly any other situation that elicits that same sort of insecurity feeling and unsafe feeling, it is absolutely going to have an impact on their mental health and their emotional development. It can lead to them feeling unsafe at school, which we already are contending with lots of other reasons kids are feeling unsafe at school right now. You mentioned the pandemic, and you also mentioned school shootings earlier. And these are all reasons where, we're seeing lots of kids really struggling with their school environment these days.
You bring up an excellent point. So let me just ask you directly. A child goes to a parent, and because of the pandemic, because of all the issues that we've just talked about, coupled with school shootings, Mom, Dad, I don't want to go to school anymore. How do you deal with that?
Yeah. So my first response would be not to say, okay, baby, we're going to keep you home. We're not going to go to school anymore. I totally understand. Or the opposite and say, sorry, you've got to go to school. That's your job. That's what we're doing. But first to figure out the feeling and the fear underneath that statement. Just kind of sit down, stop everything and say, okay, tell me more about that. You're obviously having a response and a feeling going on right now. Tell me a little bit about how you're feeling. What are you worried about? And spend some time processing and not assuming that you know what kids are worried about. It may be pandemic stuff. It may be bullying. It may be the current events and shooting situations that we've seen in schools. It may be something entirely different, like some other social situation that's going on. And so we don't want to assume we know why kids don't want to be at school. School avoidance happens for lots of reasons. So first, I just really want to understand and validate the emotion that's underneath that desire. Oftentimes working through it, validating that emotion, figuring out what they know, and then addressing any misconceptions, especially related to things like these shooting events. Figuring out, what have you heard? What do you know? Oftentimes, half of what they heard is inaccurate, or separating that fiction from fantasy and really just helping them to know the basics of what they need to know, addressing any misconceptions and fixing any kind of misperceptions in their knowledge, and then seeing if there are any ways you can problem solve. Oftentimes, focusing on reassurance and safety is really important, no matter what. And by and large, schools are fairly safe places. It doesn't feel that way right now, especially after tragic events like this. So reminding kids that most schools are very safe. Every adult in their life is working to keep them safe. And after really terrible events like this, schools are going to be working even harder to make schools a safe and healthy and good environment. And so focusing on the good and focusing on what can be done and trying to work through that becomes really important. When it comes to, I know I did not answer your question about do you send them to school or not. I know that. Right now, summer has started, so we have a little bit of a break, I think, which is a good thing for kids right now. They need some relief. As the next school year rolls around, and I think as parents and families are having to decide, do we send our kids to school or not when they're not wanting to go? I lean on the side, as a psychologist, I lean on the side of, if these things were not happening and if your child thrives in school and in that social setting, and this has been good for their development overall, let's work to find a path to continue that as much as possible. Because taking them out of school, withdrawing from that stressor, can actually lead to longer-term avoidance, longer-term anxiety and panic, and other types of problems as you are shifting their entire life and social situation and daily routine. So I would lean on the side of, let's stay in school. But if your family feels very differently about that, and this has been more detrimental for your child and you think they would thrive in an alternate environment, then certainly as a parent, it's worth considering.
What do you do if you don't have that kind of rapport and dialogue with your kids?
That's a really good question. So as a child psychologist, it behooves me to say, work to develop it. It's worth it. Even if they are kind of older, grumpy, prickly teenagers, they still need that. So going out of your way to continue trying, even if it's not working and it's not landing, that's okay. Just continue trying, because just the act of that effort from parents makes a difference in the long term for kids. However, if it's not working, if it's not landing from the parent, then identify another important adult in their lives that they do listen to, that they do have that rapport and more comfort and ability to communicate with. And, make it someone that you trust, and you can even have a conversation with that person about the pieces that you want your child to take away from this. And you can have them kind of reach out and offer support to your child during that time as well. Another alternative is see a psychologist or therapist, and they can help navigate and mediate those conversations as well. I also want to say, that probably the very first thing we all should do as parents after any tragedy that involves children especially is have our own reactions first, because we all have, deep emotional reactions to these sorts of things. And we don't want to process that in those first moments or days with our kids. We want to allow ourselves the space to call someone and express our sadness and rage and get those feelings out in a way that we don't have to doctor for our children, so that when we have the conversation with them, they're not picking up on our anxiety, stress, sadness, anger in the process, and we can focus on getting them the information they need and supporting them in the ways that they need. If your child does see you have a big response after a tragedy like this, you want to kind of do some repair. You want to explain it a little bit. Say something like, you may have noticed I've been sad. Yeah, that's a really normal reaction to have after something terrible like this happens. And I know how to handle that and how to take care of myself when I'm sad. I also know how to take care of you when you're sad. And I know how to keep us safe. Giving that reassurance and working through those feelings in a way that expresses kind of safety and ability is important.
What great comments from Dr. Stevie Puckett-Perez from Children's Health and UT Southwestern Medical Center, helping our kids during these challenging times. When we come back, we're going to talk about one of the most preventable diseases there is, next on the human side of healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the human side of healthcare. Delighted you're with us today. We're going to be talking about a very serious topic called colon cancer. And we could not have a more professional individual. Dr. Amit Desai is with us, and he is a gastroenterologist at Texas Health Presbyterian Hospital in Dallas. But before we begin this interview, I understand you listened to KRLD when you were in Waco, Texas as a youngster. Is that true?
Yeah, that is true. And I appreciate the opportunity to chat with y'all today. When I went to elementary school, my dad used to play 1080 KRLD every morning. And so, getting an opportunity to speak today, it's a pleasure. And I appreciate y'all giving me this chance.
Well, we want to thank you for joining us on the human side of healthcare. And, I don't think it can get more human than having to talk about diagnosing and treating colon cancer. But one of my first questions for you, is there a difference between colon cancer and colorectal cancer?
Colon cancer and colorectal cancer, they essentially mean the same thing, which is a cancer of the large intestine. The large intestine is essentially the last 3 feet of our intestinal tract. And what happens is we have these tiny growths or polyps that start off precancerous, and eventually they get bigger and bigger and bigger, and they develop into a cancer. But the use of the word colon cancer versus colorectal cancer, for all purposes, they essentially mean the same thing.
How common is colon cancer?
Unfortunately, it is a pretty common cancer. 150,000 cases get diagnosed every year. 50,000 people die of colon cancer. It's the second most common cancer-related death in men and the third most common in women. And we are seeing this rise in the younger population, which has prompted a lot of the recent discussions.
You're right about that in the younger populations. I know in 2020, Chadwick Boseman, the actor, died of colon cancer at a very young age. What are your thoughts about screening for colon cancer, and at what age? 50, 45, 40? What is a good benchmark for screening?
Yeah, great question. So Chadwick Boseman, unfortunately, got diagnosed at a very young age. And so it really speaks to knowing about family history, about risk factors, and getting evaluated if you have any symptoms. What's changed recently is this new age group now, the 45 to 50-year-old age group, where we are seeing this kind of alarming trend of diagnosis of colon cancer. So taking a step back, talking about kind of polyps starting first, growing, and eventually becoming cancer, what we were seeing is patients at the age of 45 were actually developing these precancerous polyps. So about a year ago, the age has now shifted down from 50 to starting these procedures or colonoscopies to prevent colon cancer at the age of 45.
So if you have a family history of colon cancer, should you start that screening even earlier?
Yeah, it's a great question. So it's important to know your family history, and it's something to talk about at the dinner table or however possible. Just, it's not comfortable, but talk about your family history, because if you know your family history's colon health or risk factors, there is a possibility that you may need to start your screening even earlier than the age of 45. Some patients need to get it at 40, potentially even earlier than that. So knowing your family history is helpful because you can inform your physician and they can tell you when to get your screening done.
And some physicians prefer to do the colonoscopies, as you know, say every 5 years. But if you have a colonoscopy and you have polyps, Should you get another colonoscopy, say, in 3 years?
It really depends on what they find during the colonoscopy and the recommendation of the physician. So if you are otherwise healthy and you come in, you get your screening colonoscopy, and they find no polyps, nothing at all, the general recommendation is you come back in 10 years. If you've got a family history, they find something, maybe the prep isn't clear, some other factors, they may bring you back in 5. And then people who actually have more of these precancerous growths may need to come back sooner. What's kind of alarming to know is about 30% of the American population has these precancerous growths. So it's common enough that we find these, and during a colonoscopy, we remove them.
So, I mentioned the colonoscopy. Are there other types of screenings for colon cancer?
Yeah, so there's tests out there that we can do. There's stool DNA tests where they'll test the DNA of the stool to look for, cancer or advanced polyps. There's a CT colonography test out there. You do have to prep for that test. And then if that test shows polyps or growths, you then prep again for your colonoscopy. As a gastroenterologist, our biggest push is to make sure someone just gets a test done. We know colonoscopies are the best test. We can find polyps, we can remove them. But if someone doesn't want to get a colonoscopy, getting something done can be life-saving.
Let's assume that you are screened and unfortunately you do find colon cancer. What are treatment options at that point?
What's incredible about colon cancer is the earlier it gets diagnosed, it can actually be treated less invasively. So what I mean by that is we can remove certain colon cancers with just a colonoscopy. We're able to cut them out painlessly, and they can be cured from it. If that colon cancer, however, has progressed a little bit, then they may need surgery. And if it's progressed even further, that's when you start talking about the need for both surgery, chemotherapy, and some patients need radiation. So the thing I want to stress about colon cancer is it is a preventable cancer, it's a treatable cancer, and it's a curable cancer. So getting in early, getting in at the time you need to get evaluated, it really can have an impact on the treatment and cure of the cancer.
You mentioned that probably one of the very best screenings is to do a colonoscopy. And, I know people go, wow, I really don't want to do a colonoscopy. How do you, when you talk to patients, address obstacles that prevent people from getting a colonoscopy?
I think the biggest concern and the worry is the day before. It's the clean out, it's the laxative, it's the colon cleanse. And so we talk about how that's evolved. It's no longer kind of the grandmother's colonoscopy where you drink that big jug of stuff. It was chalky, it was nasty. That has really evolved now where, the day before we give some recommendations on a clear liquid diet. And now the preps are a lot smaller volumes. So think about, 2 32-ounce bottles, like 2 Gatorade bottles of solution to kind of start that clean out, the colon cleanse. There's even capsules available now. So, if people don't want to do the liquid, you can actually do pills. And then just remember, the day of the procedure, it's painless. You get anesthesia, so you don't feel anything. And then someone can take care of you afterwards. You get a spouse to drive you home, eat whatever you want afterwards. So it's a pretty painless procedure. One of the things we talk about a lot is the procedure. If we find nothing, you don't come back for 10 years. And let's say we do find something like a polyp or a growth, it can be life-saving. We're able to remove it. So it's just an investment of a little bit of time in that one day to get it done.
When a polyp is removed, it's sent off to be analyzed to determine if it's benign or cancerous. Is that an oversimplification?
To an extent, that is accurate. So these polyps, we use the terminology pre-cancerous. And the reason we use that is because they're not actually cancer themselves. So by nature, they have the potential to become cancer, and eventually they would have become cancer. However, by finding them in a colonoscopy and removing them, we definitely remove them and send them to the pathologist to ensure there's no actual cancer in there for every polyp we send off.
We talked about screening and prevention, and we know prevention is the best. Is anything in our diet something that could help us related to colon cancer?
Yeah, so a lot of our studies are showing that fruits, veggies, and fish actually have a protective effect against the development of colon cancer. From a diet standpoint, unfortunately, processed meats, a high red meat diet, and I know that can be kind of tough to say in Texas, but a lot of red meat in your diet can actually predispose you to developing colon cancer. So I think overall, when you think about it, eating more fruits, veggies, kind of a heart healthy diet also has benefits in preventing colon cancer as well.
You mentioned in one of your answers that men tend to have colon cancer more frequently than women. Why is that?
There's a large role of just the genetics in men that can ultimately predispose guys to developing colon cancer. And women have much more of a kind of a protective effect. But, all said and done, it's just a slightly increased risk. There's a lot of other factors that go into it, including ethnicity, physical activity, family history. So there's a lot of stuff that goes into it. But what we do see is that men are predisposed slightly more that goes into it. And there's probably a little bit of a role in the genes there.
You mentioned something in your answer that piqued my interest, physical activity. So routine exercise helps in some ways related to colon cancer?
Absolutely, yeah. So what we are seeing is patients that go out, even walk 30 minutes a day, getting a little bit of physical activity has a protective effect against preventing colon cancer. And on the flip side, the sedentary lifestyle, which is kind of measured by, we're on our phones a lot more, watching TV, that is actually increasing the risk of colon cancer. So the more active you are, the more fit you are, the less likely you are to develop colon cancer.
We're talking with Dr. Amit Desai. He's a gastroenterologist at Texas Health Presbyterian Hospital in Dallas. When we come back, we're going to be exploring this shift to younger patients with colon cancer and why. When did it shift and what are the contributors? Next on the human side of healthcare.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're continuing our conversation about one of the most preventable diseases out there with Dr. Amit Desai from Texas Health Presbyterian Dallas. We're talking about colon cancer and colon cancer screening. One of the big disturbing trends of late is that colon cancer is affecting younger people, and unexpectedly. So, Dr. Desai, to kick this segment off, are there any signs or symptoms that young people should be watching out for?
Yeah, one thing I want to stress here is colon cancer can be a cancer with no symptoms. So age alone, 45 is the reason we picked that age, is where we start the preventative screenings. Now, if you do have symptoms, the symptoms that we do see are if you're looking at specifically colon cancer, that's when colon cancer has advanced a little bit. And that's when we start to see blood in stool, change in bowel habits, constipation, weight loss, anemia, which is low blood counts. And kind of the last thing is pain. We don't see that as often in colon cancer until it's a little bit more advanced. These are general symptoms. So, if you're 25 and you have one of these symptoms, don't rush to think, I must have colon cancer. But it's good to get evaluated for this to let your physician determine, the next appropriate steps in your workup.
So why are these younger people coming down with it? I'm sure medicine is starting to research it.
Excellent question. There's a lot of research trying to figure out why we're seeing this rise in the younger population. Part of it, we're seeing a signal in the Western diet. We are noticing that, there's probably a little bit more of a sedentary lifestyle in the younger population. And all of these are contributing to why we're seeing this. And it's a worldwide phenomenon. It's not just in the United States, it's happening in other countries. Surprisingly, Italy and Lithuania are the only ones that are not seeing it. But there's a lot of research going into understanding why someone born, after 1960 is actually at a higher rate of colon cancer to help answer that question.
Whew, just got in the door, 59. Well, so this brings a question, because really we've created a whole generation then of people that you're saying are more likely to get it. So how important of a factor is genetics?
Genetics is an important role to know because it could actually change getting screened earlier. If you know that your parents had polyps, advanced polyps, or early colon cancer at a very young age, it changes when you need your colonoscopy. So we know that as we see more and more people diagnosed with colon cancer at a younger age, that means their lineage, the younger generation, is going to need to get colonoscopies sooner and sooner. And I think that just gets us to have this discussion. A lot of times I'll see patients and they may not know that their mother, father, brother, or sister had colon cancer or a polyp. So hopefully the talk today just generates that discussion so we know our family history.
Yeah, absolutely. You've got my attention on this conversation for sure. So let me drill down on that genetic piece just a little bit more.
Mm-hmm.
If your parents had it, or if it was in your family tree, does that mean that you are at a much greater risk of getting it?
Yes. If your first degree relative, like your parents had it, you are at an elevated risk. And to talk to the screenings that are out there, and anyone with a high risk of colon cancer, colonoscopy is the only accepted screening for that individual. The other tests are used for average risk, means no family history, no genetic syndromes. But if somebody has a mother, a father with colon cancer, they are at an elevated risk and they need to get seen by their physician to know when is the right time to get their colonoscopy.
And then if a sibling has it, how is it cross-sibling?
Same thing. So if a sibling has it, we generally recommend you start your screening procedure 10 years before their diagnosis. So just think about that. Most siblings are within 10 years of their, next sibling. So a lot of times if a sibling gets diagnosed, you should go get checked immediately so that it's the right time for you to get your colonoscopy.
Okay, so we're talking a time frame here now of 1970, maybe back into the 60s, that something shifted. Is it a more sedentary lifestyle, diet? What do you suppose?
Yeah, and I think that's what we're thinking is there's a large role in the Western diet. I think there's been an evolution of diet in the last 50 years and what we have access to and the foods that we eat. We know that, unfortunately, obesity and weight is playing a role in that as well. So rates of obesity are increasing. And this is in the context of understanding that, smoking is actually decreasing. We're seeing people not smoking as much now as they used to. So these other factors are overcoming that benefit of people smoking less. Obesity is increasing. Our diet's probably not as good as it used to be. And we're seeing this rise in colon cancer. I
don't want to be inappropriate for a Sunday afternoon or evening here, but let's talk about bowel movements for a second. And just from the standpoint of, so if you don't have one for X period, whatever X is, does that mean that stool sitting in your colon could be a contributing factor?
No, that won't cause. Constipation itself won't cause you to develop colon cancer. Constipation is typically defined as not having a bowel movement more than 3 days. It's very, very nuanced per individual. So obviously get evaluated depending on how you feel. But will that cause you to get colon cancer? It will not. It won't. Just because stool is sitting there is not going to actually cause you to develop a polyp or cancer.
What does cause it?
Age. So that is the biggest thing that we cannot control. Is age is the biggest risk factor, and that's why 45 is important. Every kind of year past 45, you will potentially develop more polyps in the colon, and so that's why you get put in these screening procedures and preventative colonoscopy procedures so we can catch them as they grow.
All right, so somebody comes in, they say, "Doctor, you have my attention and I don't want colon cancer." But they haven't taken the best care of things. They haven't been to their PCP, their primary care doctor, for a while. Where do you begin?
If they're over the age of 45, get a screening procedure done, prefer colonoscopy. No matter how unhealthy or healthy you are, it really comes down to getting a baseline evaluation of what your colon looks like. What we know is you can be, let's take the scenario of perfect bill of health, works out all the time, eats perfectly, it has zero medical problems and comes to see us and says, "Doc, what do I do?" You still need a colonoscopy at the age of 45 because that alone is your biggest risk factor. And we have not figured out a way to stop that. We can't reverse mother time. So that alone is the indication to say, okay, time to do your procedure.
And obviously, we're trying to prevent what happened to a friend of mine here who, through a colonoscopy, discovered that she had cancer and it was already at stage 4. So what kind of an outlook would somebody in that situation have?
It depends on the stage. Stage 1, and first thing we do when we diagnose colon cancer is you typically get a CT scan, you get some blood work, you get evaluated by an oncologist, which is a cancer physician and a surgeon. And there's 4 stages of colon cancer, and it can get very kind of nuanced within each stage. The earlier stages, stage 1, stage 2, those can effectively be curable cancers. We can completely remove them. And, we look at how patients do after 5 years, and they'll get follow-up colonoscopies and follow-up CT scans, but those can be cured cancers. When you start to look at stage 3, stage 4, that tends to be more of a discussion with the cancer physician, and it depends on treatments and how they respond to treatments and what their follow-up scans are, but there's still some options to try to remove that cancer and get them cured.
Such a great diagnostic and preventive tool in medicine. This has been Dr. Amit Desai, gastroenterologist at Texas Health Presbyterian Hospital in Dallas. Wanted to remind you of our podcast as well. It's The Human Side of Healthcare. All the audio podcast players, the Odyssey app, and YouTube is where you'll find us. Both of today's interviews are on the podcast in their entirety, so if you have school-age kids, you might want to revisit that one with Dr. Puckett-Perez. And Steve, I'll bet you are up to date on your colonoscopies.
Yeah, I had a colonoscopy last year. I get colonoscopies routinely. And to the folks out there listening, hey, get those colonoscopies and protect your lives. Hope you enjoyed this show. Stay safe and join us next week for The Human Side of Healthcare.